So today this video will be about treatment and how do treatment centers work, as well as the process of finding mental health care and how does that look like. So we'll be discussing a few different topics today, but we will mainly be discussing a 5-step care pathway system and how that can benefit you, as well as what type of treatment you should be looking for yourself, maybe other individuals, or perhaps loved ones that you are concerned about. So to start off, there are many different pathways a patient can take to treatment. But however, the studying of the pathway of care helps us in analyzing health services use, health services care, identification of the sources of delay in attending and receiving the right care, and to find and target the potential solutions that could help that patient. I also want to point out with what I will be going to discuss with you guys today. So I will be referencing a few hospital-based studies, which means that they are not based in home care or home assistance. There are a few mental health treatment programs that are like that they come to you, to your home, and help you through that pathway. But we'll mainly be discussing institutionalization, as well as care centers, treatment centers, and anything in between that you may be able to think of. However, if any of you guys are very interested in more of the research or the background behind home care and home assistance, especially how it applies to students as well as the general public, I will link a few things down below that you guys can check out independently if that's more of a process or something that you personally would like to pursue. So pathways of treatment often differ based on each treatment center, meaning that each treatment center will have a different approach and a different way to approach patients and how to help or totally get rid of their mental health condition or disorder. However, there are some universal protocols and information that all treatment centers use. One of the more widely acknowledged systems is a 5-step care pathway system. And basically it's just a scale from step 1 all the way to step 5. Like I said, just step 5, 5 steps. And step 1 being the least invasive form of care, all the way to highly invasive, highly specialized care, which is step 5. And normally that's reserved for individuals who are looking for mental health institutionalization, and they do need very, very specialized care and 24/7 monitoring in order to ensure their success and release back into normal society. And I do want to point out the 5-step care pathway, which we will be discussing in 1 minute, is also used in specialized programs as well as generalized programs. And what I mean by that is that generalized programs for treatment centers are psychiatric institutions that will take in any patient who has a medical disorder or condition, not necessarily meaning that they'll take in everyone who approaches them, but they'll take in a wide variety of individuals who approach them looking for medical attention or mental health treatment. However, there are specialized programs, and oftentimes those specialized programs are embedded in a more general acceptance and approach. So, meaning that the psychiatric treatment center or psychiatric facility or institution can bring in more generalized patients and then give them more specialized approaches to their medical or mental health condition later down the road. However, there are also institutions that just cater to specific or specialized programs for individuals who have severe cases in terms of mental health disorders. Keep that in mind when you're looking for care for your family member or yourself, because sometimes if you are willing to pay a little bit more, or you're willing to look for more of a specialized program, that oftentimes specialized programs in specialized institutions will be a little bit more willing to work with you, especially considering that mental health disorders that do require specialized care are often a little bit more challenging to deal with day to day. So, what is a 5-step approach? So the 5-step care pathway is used by most institutions in terms of kind of getting involved with the mental health care pathway and understanding what the patient needs. And this also is a great pathway to use to assess yourself or other individuals of the level of care that you think you may need. Now, I do recommend doing this yourself. It is a great way to assess where you stand in terms of mental health condition and what you're looking for, but I also do recommend that you consult a physician, a psychologist or psychiatrist before you go down this pathway of institutionalizing yourself, or perhaps others you may be concerned about. So, it's always a big issue in terms of mental health of what's best for the patient, and that is and should be taken into consideration in these types of situations. So I'm going to list the 5 different steps that are in the 5-step care pathway. So the first one is step number 1, which is self-directed help in health and well-being services. Number 2, or step 2, is primary care talking therapies. Step number 3, specialist community mental health therapies. Step 4 is highly specialist condition-specific mental health services. And step number 5 is high-intensity mental health services. So you can definitely see that the self-directed help in health and well-being services is much more of a less invasive approach, like I said earlier, for individuals who are looking for more of a minimally invasive way to address any mental health concerns or conditions, whereas step 5, the high-intensity mental health services, are reserved for individuals who are in very specific and very unique situations. So I'm going to go through each one now, just to get a little bit more of an understanding of what they are. So the first one, step number 1, self-directed help in health and well-being services. So basically, like I said earlier, this is for individuals who are looking for a minimally invasive way to approach their mental health conditions. Oftentimes for individuals who fall into step 1, they're really looking for treatment for anxiety and depression, but very, 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 very mild cases of it. Oftentimes you'll see individuals with anxiety and depression that are on higher steps, but we'll get to that in 1 minute. However, at this step, you can try and treat your mental health condition, or at least mitigate it, by trying to incorporate a different lifestyle into your day-to-day life and activities, as well as coping/reassurance strategies. Meaning that maybe you want to do a diet change, maybe you want to change the schedule that you have per day if you do have that luxury. And if you do, I do recommend for individuals who are at step 1 to approach their mental health condition or crisis in that manner, because oftentimes that's all that individuals from step 1 would need to help mitigate their issues. Step number 2 is primary care talking therapies. So talking therapy is a little bit odd. It's actually referring to therapy. It's just more of a professional definition. So talking therapies involves going and talk to a psychologist, whether it's a clinical psychologist or normal psychologist. You can also go to certain psychiatrists will offer this program as well. Talking therapies they do offer. So if you are looking for more of a hands-on approach, I would say, to helping individuals who may need mental health help, as well as assessing yourself for any conditions or disorders that may be present, then I recommend doing talking therapies, because it's a great option for individuals who want to get a new strategy in place and are very active in seeking help for their mental health condition or disorder. However, therapy isn't for everybody. Oftentimes with individuals who do have mental health conditions that do require drugs or perhaps a different approach to treatment, talking therapy isn't for everyone. And I know that therapy is becoming much more normalized in society, which is amazing and great, but if you are looking for help and therapy does not seem up your alley, or you've tried it and it doesn't seem to work, you don't need to continue with it. There are a lot of other therapies and different treatment programs that you can go through, as well as ones that you can find online that could help you with that as well. However, that does bring us to our second step, or our third step, which is specialist community mental health services. So this is a little bit more invasive than step 1, step 2. This involves psychological and drug therapies, meaning that if you do have a mental health condition or disorder, at this point you would be prescribed drugs, or you would be going through specialized, or a little bit more specialized, I should say, psychological therapies, which are intended to help you and kind of understand what's going on internally. If you do have a pervasive mental health issue, I recommend you guys to go down this pathway, because oftentimes I think it's a little bit more effective if you do have kind of like a stubborn mental health condition that just won't go away, or it requires constant attention and management. Also, if you do have a more severe form of depression and anxiety, then this is actually a great step, because you can be prescribed medications as well as other types of strong therapies to help combat any extreme anxiety or depression you may have. So step number 4 is the highly specialist condition-specific mental health services. So step 4 and step 5 are much more invasive, and I wouldn't say invasive in a bad way, but for individuals who are looking for highly specialized care and who do have a disorder that is extremely hard to treat or is very rare, often specialized care is the best possible option. Or again, if they are resistant to psychological or drug therapies as well as talking therapies, step 4 and step 5 are some steps that you can take in the future, or at least some steps that you can take into consideration. So step number 4 is a much more specialized form of therapy, and it has multiple therapies as well. So not just one therapy, there's a lot of different types of therapies that you can research that fall under this category, step number 4. I will link them down below if you're interested. But it really just provides care to individuals who need a much more specialized or complex mental health needs and desires. They are delivered specialized programs which are delivered by many specialized mental health clinicians. So again, if you are looking for more of a specialized program, you will find these specialized programs in step number 4 and step number 5 and in more specialized treatment centers. And step number 5 is just a little bit more intense than step number 4. It's high intensity mental health services. Now this is kind of the last stop for individuals who are looking for mental health care. After this would most likely be permanent institutionalization, which is unfortunate, but for some individuals that's actually really, really good, especially if they have a very severe disorder or condition that does not allow them to interact with society on a day-to-day basis. So this involves new problem solving coping strategies with the delivery of intensive recovery focused support. And it's kind of interesting that that is included in step number 5 because new problem-solving coping strategies can mean anything. I mean, they can be a new strategy that's institutionalized and put into practice, or it can be an older therapy that's repurposed to help the specific individual based on their situation. Now that we've gotten through all 5 steps, I hope you understand them a little bit more. I will again have the PDF and some more information for individuals who are interested in going a little bit more in depth of the science behind these steps down below so you can read them. They're great for any research projects. They're also great for just community information as well as knowledge for the mental health community, especially for individuals who are newer and to the mental health community and are attempting to navigate it. It can be pretty tricky. I do want to point out though that now that we are done with going through all of those steps, that it is great and very, very important that you have the best interests of yourself or other loved ones in mind while looking for the best possible pathway of treatment. While it is great to be proactive and look for mental health treatment yourself, I think that in the start of any beginning, you should take it slowly and try and process what is best for you or the other individual you're looking for care for. If you rush into any situation, not only will you pay a ton of money that is non-refundable, but you will also end up potentially harming the individual because it's not the right type of care that they needed. But now, with that being said, this we'll go into the next section of this video, which kind of plays into the 5-step care pathway system that we just discussed, but it'll be the different types of institutionalization as well as treatment centers that are available to you, and we will delve a little bit into home care and home assistance. So there will be 5 different types of institutionalization as well as care that I will be discussing. The first one being acute inpatient wards. Now, acute inpatient wards is a fancy way to say generalized treatment. It's more of a broad way to treat conditions for general help for individuals who can't go through community services or subsidized services that are offered by certain and select states. So if you're looking for generalized care, oftentimes treatment centers, care centers, or institutions will offer acute inpatient wards. And I think this is a great option for individuals who are also looking for an assessment of their psyche and their mental health. Oftentimes, individuals will seek that independently or proactively before being institutionalized or seeking institutionalization for themselves because it is a great way to understand where you stand and what you need for yourself. Another similar topic is PICUs. And PICUs is, again, a fancier word for a very basic topic, which is specialized treatment and specialized programs. So PICUs are more specific wards that are able to serve individuals who aren't normally able to be treated and would need a more specialized environment for whatever they're going through. And PICUs are sometimes more expensive than just acute inpatient wards because they have more specialized care, so they will have specialized clinicians and medicine that is designed to help you or your loved one, so oftentimes it will be a little bit more pricey. I will be discussing price in 1 minute, so we can get into that a little bit more then. The next one is home treatment team or home treatment teams. So basically, I delved into it a little bit earlier when I said home assessment and home home care. But with that being said, I'll link some of the important resources down below that pertains to home treatment teams so you can read about them. But basically, it's just a team that comes to your house, whether that's clinicians or a professional in the mental health field, like for example, psychologists, psychiatrists, or perhaps the clinical social worker. They'll come over to your house and they will do assessments with you. And they can provide care that institutions can't or treatment centers in my opinion, not as effectively, but they still will provide help for you. And I think it's a great option for any individuals who are also suffering from medical conditions that perhaps limit their ability to get out of the house, or individuals who perhaps have social phobias or specific phobias of interaction, so it gives them a more comfortable space to explore their mental health condition and what they can do about it. Another one is acute day services. So I'm not going to discuss this as much because this is often a last step in terms of the mental health treatment process. So acute day services, there can be two, one that will come to individuals' homes per day each day, and they will manage and monitor the individual who does need mental health treatment, or perhaps they have a specific disorder and condition. They can always come to your house and discuss with you alternatives to being institutionalized, as well as monitor you and continue to give updates to your loved ones. But most of the time you're going to see acute day services used after individuals are institutionalized or have gone through home health services and assessments for their mental health. Oftentimes you'll see this for individuals, for clinical social workers or psychiatrists. They will come out and monitor your condition and do a mental health evaluation every once in a while to make sure you're on the right path to recovery. And I think these are really great services. I believe you can find minimally invasive acute day services for individuals who are in step number 1 of that 5-step care pathway program we discussed a little bit earlier, but I will double check and I will link that down below if I find anything. Alright, the final one we'll talk about is home treatment beds or crisis beds. And this is a little bit of a different situation that some individuals are used to in terms of treatment. Oftentimes it's just a small community facility that has beds provided by a single trust for its population, which in my opinion isn't as effective as the other options, but oftentimes for individuals who want to remain at home and maybe they're suitable for home treatment but are unable to remain at home, this is a good option because it's a little bit more of a comfortable environment, as well as they can explore themselves and grow mentally as well, because oftentimes crisis beds and home treatment houses are for individuals who have also had a breakdown in terms of familial relationships. So with that being said, I want to say thank you guys so much for watching, and if you have any questions, like I said, I will try and answer them in a timely manner. Thank you so much. Bye.